The weekly reported confirmed cases is always surpassing 10 million cases, while the Asian region is seeing a rising trend. Countries neighboring our nation has created a daily record day by day, while the threat and spread of COVID-19 has been increasing. Recently, we are seeing a sporadic occurrence of the COVID-19. The majority of the mutation is mutation Omicron. Since March, the occurrence of these COVID-19 confirmed cases has becoming very frequently and creating a wide range of occurrence covering 28 different provinces. The difficulties and risk of the prevention and control of COVID-19 is rising. And the general principles guiding the COVID-19 prevention and controls, including the dynamic control, is effective, and we should stick to the principles. And we should also stick to the principles of imported cases should be targeted at, while the domestic cases should be looked after. And we should also adopt a very quick epidemiological research and PCR testings, while we should also focusing on the prevention and control mechanism in the community levels and quarantine those who should. We should always stick to the principles that we should wear the mask, frequently wash our hands, use the ventilations and small gatherings, and also 1 meter distance between the peoples. And we actively ask all the citizens to be vaccinated, especially those who is above 60 years old. By the end of the 14th of March, the reported vaccinated case in China is reaching 3.1 billion times, and the total populations which has received 3 different types of vaccinations is reaching 1.2 billion. The theme of today's press conference is about the latest development of the vaccinations and also the development of the COVID-19. We have invited Mr. Wang Dengfeng, who is the Deputy Director of the Education Department of the Ministry of Education, and Mr. Lei Zhenglong, the First Counselor of the State Prevention and Control Center, and the Chief Expert Wang Huaxing from the China Disease Prevention and Control Center, and Mr. Li Jingming, who is the head of the Disease Prevention and Control Center in China. Now the floor is open up for questions. Please identify your affiliated association before the questions. Thank you very much for giving me this opportunity with CMG. Recently, we are seeing a sporadic rise of the COVID-19 cases. So the question is, how do we evaluate the current situation of COVID-19 in China? We are going to direct this question to Mr. Lei Zhenglong. Thank you very much for your question. Affected by the fourth wave of the COVID-19 ranging across the world, especially affected by the neighboring countries and regions in China. In the recent days, we are under a huge pressure for the confirmed cases. Since March, the imported COVID-19 confirmed cases is triggering a trend domestically and spreading this disease wider. Since the 1st of March to the 14th of March, the accumulated reported cases in China is reaching 15,000 cases, ranging across 27 different provinces and regions. And recently, Jilin, Shandong, Shanghai, Guangdong is seeing a rising of the cases, and in some of the regions, the confirmed number is still on the rise. We believe the trend to spread the disease is rising, and all the different cities and regions is trying to vaccinate and quarantine the confirmed people. Generally speaking, the domestic confirmed cases is frequently occurred, while it is ranging quite heavily across the country. We are facing a quite strict situation in our country. While the prevention and control work of the COVID-19 across our country is still under the control of our mechanisms, the joint mechanisms of the prevention and control of the State Council has dispatched a special workforce to Yunnan, Guangdong, Shanxi, among other different regions, to help the local quarantining hospital and also the local treatment centers to understand the epidemiological causes of the COVID-19. And we are also going to promote the epidemiological research to put every personnel under control, and this is how we are going to consolidate the result that we have achieved. Thank you very much. With Guangming Daily, in the recent few days, the newly confirmed cases in Jilin province is rocketing, which is catching the eyesight across the country. Can you introduce us the latest development of the COVID-19 prevention and control in Jilin province? Thank you very much for your question. For this occurrence of the Jilin province, it is being clustered in the Jilin city and Changchun city. We have adopted a classified categories for the treatment work. So the reason or the meanings of the classifications of the works is to identify the different cases, including the highly risk cases, severe cases, and those of the elderly people with the underlying disease. These high-risk groups is going to be groups of the patient is going to be adopted in the comprehensive level 3 hospitals. For these asymptomatic cases and the mild cases, these patients goes to the makeshift hospital. Until this morning, in Jilin province, the confirmed cases is 8,100, among which there is 2 severe cases. The majority of them is the common cases, and 95% of the case is mild case and is asymptomatic case. We have contacted the Jilin city and Changchun city and dispatched a national level work team to help with the local prevention and control mechanism. Since Jilin city has a relatively weakening medical frontline forces, we have also dispatched a special national team from our country, and we have dispatched a special medical workforce from Heilongjiang province who is working on the ICU teams, and we have also dispatched 3 medical teams from Henan to support the Jilin province's work and the transferring of the cases. These medical teams has taken over some of the high-risk factors patients. At the same time, the expert team that we dispatched to Jilin province is checking all of these medical words every morning and every night to figure out the latest development of the patient, adopting the prompt measures. While the other experts is also touring around the makeshift hospitals, giving the in-time guidance to the local patients and local treatment methods. These transferring patients and these aggregating patients is going to transfer to the comprehensive hospitals. Through this mechanism, we are going to improve the treating result for the Jilin province. Standing on the current situations, the treatment result is very satisfying. With the China Education Television, there are some of the cases clustered in the middle schools and universities. We have understand that it is very easy to see the clustered up cases occurred in the school and campus. So what kind of difficulties are we facing in the education sector? We are going to divert this question to Mr. Wang Dengfeng. Just as your question has noticed, every time there is a sprout up of the cases, unavoidably we are going to see the appearance of the campus. For this round of the COVID-19 confirmed cases, we are seeing some of the cases occurring in the middle school and high-level education institution. There are some of the common reasons and risk factors unique to these schools, but first and foremost, it is because we are becoming relaxed after 2 years of the COVID-19 and after a smooth operation. So how are we going to keep alert and keep on guard of the COVID-19 prevention and control? It's going to be a testament for our day-to-day work. And this is also a question facing across the society. From the school's perspective, on one part, there is a very huge gathering of the students, especially in the college campuses, while they are lacking the prevention control forces in this campus, especially for the sporadic cases. In one school campus, there are tens of thousands of students, and it's difficult to find a building to quarantine them. This is some of the headaches that the education systems used to face in the past. Are we going to launch the preparation plans according to what we have designed the plan? For one part, it is related to the management of the school itself. For the other part, the local governments and local educational institutions should help the colleges and the campuses to land this emergency mechanism as quickly as possible. For these several different sporadic cases occurring in the campus, if there is any delay, one of the major reasons is that they did not launch the emergency plan. And especially for those who are going to be quarantined, we should quarantine them according to the times. So from the education plan, this is one of the most distinct features that we are facing. It is related to the responsibilities from 4 stakeholders. So how we guarantee the emergency plan we are going to be initiated under the real emergency? The second problem is about the teachers and students. They entered into the campus every day. This is something quite similar to other different workplaces. The day-to-day entry of the school campus means that we should have a very good control of the school's gate. How are we going to promote the two things in parallel is going to be a challenge for our schools, because school is a place that must be visited by the middle school and the primary school students, especially for the college students. They have all kinds of reasons to get onto the campus and get in of the campus. So under such a mechanism, how are we going to make sure that this necessary in and out of the campus is not going to affect the prevention and control of COVID-19? It is an answer related to the school's initial emergency mechanisms as well as the society's support. Thirdly, the health management of the teachers and students in the campus is widely spread. It's actually so for the students, they go home every day, while the epidemiological choices of the family members is going to affect the health of the students, where the students is going to bring the virus back to the campus. From the school's point of view, we do not have a very effective measures to control the previous trace of every household's family members. At the same time, it is very difficult for us to get in time registrations of the information for the traces of the students. This is also very important. And the fourth method is about the school's places. It is closed. But sometimes there are really some of the cluster of activities in the school campus. There are the closed-door classrooms, closed-door laboratories, and closed-door experimental buildings. So how are we going to better manage these campuses? It is also something that is difficult to manage during the process. These are the difficulties that we are facing from the education system. In the past 2 years, under the firm leadership of the State Council and the CPC Central Committee, we have always kept an eye on the prevention and control of the COVID-19 and prioritize the health of the students and teachers. Under the current situation, we should have a clear awareness of the COVID-19 prevention and control. We should stick to the 4 principles of the early identifications, and from the Ministry of Education's perspective, we should make sure of the 2 confirmations. The first confirmation is about the real translations of the prevention and control mechanisms really works in the campus, and the second that we should make sure all the emergency mechanism works during the emergency. Thank you very much. With Phoenix TV. Facing the newest mutation of Omicron, what should we do in our daily prevention and control work? Thank you very much for your question. According to the epidemiological result of the COVID-19 prevention and control, the occurrence of Omicron mutation is surpassing the aggregations of the previous mutations. That is to say, it is widely spread. We have all understand that the mutation of Omicron makes that it is spreading very quickly. At the same time, it is not easy to discover, creating a lot of difficulties for the prevention and control mechanism. So here we want to emphasize about the health of the elderly people. So while there is spread of the Omicron mutation, there is a lot of dangers bringing to the elderly people. For the regions across the world and for certain regions, the Omicron is creating a lot of inhospitalized cases. And there are so many cases about the Omicron, creating the tensions in the medical resources. Under the current situation, the vaccination and inoculations, as well as PPEs, are the major work or measures that we could adopt it. So here we want to emphasize about the prevention and control work of the elderly people. For those who are not vaccinated, please do go to the vaccination place as quickly as possible. And for those who are not get 3 vaccinations, please fill up the gap. And if these elderly people who is in line of the 3rd types of the vaccinations, please go to the vaccination places and finish all the vaccination procedure. Here we also suggested that all of you should do a very good job of prevention and control. Wear the medical mask, wash your hands frequently, keep a social distance. And here we also want to emphasize once again that do not go to the densely populated regions. This is also very important for the elderly people. And another thing we want to emphasize is that where there are some people clustered up, especially in the nursing houses and also the entertainment centers, we should do it according to the prevention and control measures. With People's Daily, in the recent few days, the Joint Prevention and Control Mechanism of the State Council has printed a white paper on the antigen testing. So what is antigen testing and which groups of the population is fitted for the antigen testing? Thank you very much for your question. The COVID-19 virus is being composed of the nucleic acids and antigens. There are 4 types of proteins inside of the antigens. There are the membrane proteins, and the major proteins that we are testing is the N protein. One feature of it is highly expressed and difficult to mutate. With such a frequent coupling of the COVID-19 virus, it is easily to be reflected whether the patient is being affected. The antigen testing at one of the major groups is there are three different groups of the people. One is those of the patients who goes to the communities who have demonstrated fever and fatigue within 5 days. If they have a negative testing results, and they can stay at home and for the 5 days of the antigen testing. If a real COVID-19 positive cases and the consecutive 5 days, they are going to demonstrate a high level of virus in the consecutive 5 days. And if they have a lower concentration level of the virus, they are not going to demonstrate it. The second question is about those of the people is in quarantine, including stay at home and imported cases, as well as the sporadic cases. And some of the households who is in the controlled and prevention community areas. After a consecutive 5 days of testing each one of the days, if there is a positive result, you can test it out. And if it is negative, you don't need to interfere. After all the quarantine is being dismissed, we are only going to conduct it 1 time of the NPC testing. For those of the groups of the residents who want to test about themselves, if they are going to test it about the positive, they are going to go to the PCR testing. If they are negative, they are going to stay at home and come to the testing when it is necessary. With those other features, which is very clear, they need to go to the fever clinics. For those who are losing their appetite or all-free functions, they definitely should go to the fever clinics because the loss of the smell and tasting is one of the major features for the COVID-19 patient. Thank you very much. With CMJ Finance Center, in the recent few days, we are seeing there is a rising ratio of the asymptomatic patient. Is this one of the features for Omicron mutation? Facing these situations, how can we deal with it? We are going to direct this question to Mr. Lei Zhenglong. Thank you very much for your question. Currently, the Omicron mutation and Omicron strain is one of the major strains ranging across the world and even creating a lot of damage in our country. It is a highly mutated strain. In the recent few days, the subtype 2 of the Omicron mutation is spreading quite rapidly. And we have also found that those who are infected is demonstrating as majorly as asymptomatic and wild. In the recent few days, the domestic cases is occurring very frequently, creating a lot of difficulties for the prevention and control in our country. After the analyzing of the experts, the dynamic controlling mechanism in our country and a series of the prevention and control measures in our country is very effective while we are dealing with the Omicron strain. The vaccinations of the COVID-19 is also going to help with the occurrence ratios of the Omicron mutations. As we have noted, the Omicron strain is spreading quite rapidly and not easy to discuss, which is requiring for the stricter measures. Moving forward, the National Health Commission is going to focusing on frequently testing for the Omicron, and we are also going to guide all the local governments in the day-to-day prevention and control. The first one is that we are going to prevent the imported cases, and we are also going to enhance on the closed-door management. We are also going to emphasizing on the gateways and customers, and also the imported refugee streams. And we are also going to focusing on the imported international frozen food. We are also going to focusing on the truck drivers for these imported foods and beverage. Secondly, we are also going to stick to the principles of 4 early people, early discovery, key people and key regions and key discoveries. We are also going to stick to the principles of to get vaccinated for those who should, and stick to the principles of the highly risk regions, working on the frontier where the pharmacies and the hospitals is going to work. We are also going to work on the testing mechanism for the PCR testing and perfect the management and screening systems of the COVID-19. And we are also going to increase the coordinated effort. And for the first time, we should also land the prevention and control mechanisms in the schools, in the factories, in the markets, and in the supermarkets. We are going to conducting an early discovery and early distinction of the COVID-19. And thirdly, we are also going to work on the elderly people's vaccination, especially those who are above 80 years old. At the same time, we are also calling for all the local governments to find all the loopholes of the prevention and control mechanisms and get rid of the COVID-19 and make up for the loopholes. And this is also what we are calling for the general public. Please wear a medical mask, wash your hands frequently, keep the social distance, and get vaccinated and inoculation, and maintain and consolidate the unswerving result of the COVID-19 prevention and control work of our country. With CGTN and CEMG, since the COVID-19 prevention and control, there are some of the short-time demand PCR testing. How do we satisfy with short-time demand of the PCR testing? How are we going to provide an in-time PCR testing for those of the gateway cities? Thank you. Thank you very much. Since the outbreak of the COVID-19, in the year 2020, the State Council has printed a guideline of increasing the capacities of the nuclear acid testing, allocating all kinds of resources and the PCR testings. For all the different regions, they were trying to land these resources. For one part, they are buying these equipments, increasing the laboratories and equipments, training the laboratory experts in the past 1 year. In the past 1 year, we are supporting the third-party nucleic acid testing and regulating the day-to-day effort. So far, the portable testing result, including the makeshift vehicles, has greatly improved the COVID-19 mechanisms. This dynamic supporting system to the port city has been enhanced in the past 2 years. According to the statistics, by the 30th of March 2022, there is 1,420 institutions who is conducting the services of the nucleic acid testing services, among which 8,824 are hospitals, and there are 863 third-party testing laboratories. The national testing capacity can be around 46 million testing tubes every day. So we are very strong in our abilities in terms of the testing. In the year 2020, we have came up with the technologies of the mixed PCR testing, and in the year 2021, we have a non-mixed isolated PCR testing. In this year, we have improved the testing result to around 20 people 1 tube. So that is to say we can increase the capacity 20 times based on the current situation. So in terms of the PCR testing, we are leading across the world. For the sporadic cases of the PCR demand, recently, we have built a regional supporting system for one part in our province. We are allocating the resources in our province, supporting the PCR testing. For the other areas, if the local province and cities cannot satisfy with the current demand, we also have a regional supporting mechanism. You have mentioned that in the port cities, under the regular day-to-day work, their testing capacity can satisfy the demand. And once there is any cluster up of the COVID-19 cases, through the supporting mechanism, we are going to satisfy their demand. Currently, we are using several different measures to improve the short-term testing demand. For one part, we have built this supporting mechanism, especially this dynamic supporting mechanism. For the other part, for some of the lower risk regions, while we are conducting a large-scale screening, we are promoting the 20 people per tube testing methods. And for this 20 people per tube testing technologies, as well as the plans and also the large-scale PCR testing, we have conducted updated versions and also the trainings. And one thing quite important that we are using the informationized methods to improve the testing methods, and we are using the information technologies to test and to improve the testing result and shortening the time between the nucleic acid testing and the final result. And one thing quite important is that last week, the joint workforce on the prevention mechanism and the control mechanism, the State Council has come up with the antigen testing as a very important supplement to the PCR testing. By fully playing the role of the antigen testing, we are going to combine the two advantages of the PCR testing and the antigen testings. And for the first time, we can test it on the asymptomatic cases of the Omicron strain and figure out the potential infected person. And that is to say, in the shortest period of time, we are going to control the infected the routes, and we are also going to spread the PCR testing, increasing the chance of the early detection. Thank you very much. With Xinhua News Agency, we understand that during the implementation plans of the antigen testing of COVID-19, in order to improve the early detection capacity and promote the screening of the antigens and also the capacities of the antigens and increasing adding the antigen testing as a supplement of the PCR testing. So my question is, what's the difference between the antigen testing and PCR testing? What is the relations and how do we coordinate these two testing work? We are going to direct this question to Mr. Li Jingming. Thank you very much for your question. For the antigen testing, we are trying to use the reactions of the antigens and antibody combinings to testing the A protein. One of the features of the antigen pre-testing is very quick and easy to test. Let me give you an analogy. We are actually using the testing methods of the pregnancy test. It works as the same logic as the pregnancy test. So by calculating the masses, with the exponential testing capacity with the PCR testing, it is easy to come up with the result. So if a people is affected with COVID-19, their COVID-19 concentration is demonstrating from small to very dense in our throat. If there is 1 million or even 10 million COVID-19 virus in the throat of the patient with the antigen testing, we can come up with a final result, which is going to help us with the prevention and control. Another feature of the antigen testing with the PCR testing is about its peculiarity. So for those of the testing result, it can achieve an accuracy of 99%, while the PCR testing have an accuracy result of 100%. So that is to say, the PCR testing is one of the deciding factors for us to confirm the COVID-19 cases. So the antigen testing cannot replace the PCR testing. So while we are having a positive PCR testing result, please come for the second time confirmations. But if the PCR testing result is positive, it means the cases is being confirmed. But if the antigen testing is positive, it needs a double check. Thank you very much. Currently, what is the latest progress of the vaccination? And are there any new measures for the elderly people's group? Thank you very much for your question. According to the arrangement of the State Council and the CPC Central Committee, all the local governments is promoting the vaccinations and all different groups of the population. By the 31st of March, the totally vaccinated population and the times of our country is reaching 31 billion times. The total vaccinated population and inoculated population is 1.2 billion, among which those who is above 60 years old is 221 million times. COVID-19 vaccinations, inoculation, plus a very effective personal protection is the dominating method during this pandemic. Recently, we are seeing that the elderly people is one of these vulnerable groups under attacks, especially those elderly people with underlying disease. They are easily to turn into the severe cases after they have been infected, and they are going to gain the most during the inoculation. To better serve the elderly people's group, we have conducted multiple times special arrangement for these elderly people's inoculation, giving guidance to all the regions and innovated in this area. We are also working to test those of the elderly people who should. And for a lot of local governments, they have opened up the green channels for the inoculation. We are also working that for all these elderly people, they can feel the warm services designed by the mechanism. We have also asked for all of you to encourage the elderly people in our family and in your neighborhoods to get inoculated. Thank you. with global times. Across the country, there have been an enhanced new strain inoculation. What is the difference between this one and the previous enhanced inoculation? We have introduced you about this sequential enhanced inoculation compared with the enhanced inoculation. The common vaccination plus the enhanced inoculation is using one type of the vaccination to address all the different rounds of the inoculation process. But for the sequential enhanced inoculation, it is being designed from two logics. How are we going to improve the immunity of the patient? The second question is how are we going to perfect the procedure and reduce the adverse event to occur? The inoculation of the COVID-19 vaccination, as introduced by Mr. Wang, is very effective in the prevention and control of the COVID-19, and is also preventing the mild cases from getting worse. In the past 2 years, it has been testified once again that the vaccination, with the time passes by, it is generating a dwindling effect in terms of the protection, creating a lot of escape effect of the patient. Under such a result, there is an international consensus that through the increasing of the vaccination and through conducting the enhanced vaccination mechanism, this is going to greatly improve the prevention and control mechanism. Currently, in our country, we are enhancing the inoculations, and we have two strategies. One is that we are going to use the homogeneous sequencing method, and we are also able to conduct the heterogeneous COVID-19 inoculations. We have emphasized once again that the combined condition is going to help those of the groups who are going to be inoculated. For those who are not inoculated, they should get the enhanced inoculation. And thank you for that is my answer for your question. Thank you very much. With 1,000 metropolis, the parent is actually cares about this wave of the COVID-19 outbreak. How do we prevent the occurrence of the COVID-19 in the school campus? Actually, the major target for our prevention and control of the COVID-19 mechanism is to guarantee the safety and health of those of students and those who are working and studying in the campus. These mechanisms works across the country. And from the education perspective, how are we going to guarantee the health and stability for the students and teachers? This is one of the priorities. Starting from the beginning of the March, the Ministry of Education have been focusing on all kinds of prevention and control mechanisms. On March the 9th and March the 13th, there are 2 television speech conducting on, and on the 14th of the March, we have printed a special notice of the prevention and control mechanism of COVID-19. On the special television address of COVID-19 prevention and control in the education system, the minister has came up with very clear instruction. We should focusing on the 4 enhancement. The first one is to enhance the political responsibilities. We are emphasizing the 4 stakeholders' responsibilities, and each one of the parties should shoulder the responsibility, no matter for the local governments, local educational institutions, local schools, and also the students and their parents. and the teachers should shoulder the responsibilities. And the second is that we should emphasizing on the prevention and control of COVID-19. And that is how we are going to really implement this mechanism. There are 28 provinces and regions in our country occurring where the COVID-19 cases occurred. And there are several dozens of the provinces and regions where in the educational system the COVID-19 cases occurred. We should focusing on the transfer, treatment, prevention, and control mechanism in the education system, combining online and offline education methods. And for those of the areas where the COVID-19 cases has not occurred, we should emphasize about the day-to-day regulating effort and stick to the principles of the National Health Committee and follow up the prevention and control methods, making the regulating prevention and control methods in the COVID-19. Thirdly, we are going to improve the emergency treatment methods, as we have noted, especially for the high-level educational institutions. Once the COVID-19 occurred in the campus, how are we going to initiate the emergency plan is going to be the key deciding factor for these methods. And we are also going to initiate the schools in the all levels to follow the requirement and the procedures in the different levels of the government to fully implement all the pre-plans, especially when there are some of the sporadic cases in the campus. Large-scale transfer of the students and teachers is something cannot be delayed. And this is the key work for the prevention and control work in the education system. And the third one is that we are going to enhance and improve the prevention and control mechanisms in the campus. As I have introduced to you, the school is closely connected to every household and every families, especially for the students who is in the middle school and primary schools and high-level educational institutions. How are we going to guarantee that they are going to follow all the procedures even if the students is staying at home? And for those of the people who are living together with the students, with the teachers themselves, means a heavy burden for the education system. And this poses new requirement for the education group. And the fifth part is about the people-to-people caring and servicing mechanisms. Once the COVID-19 mechanism occurred, how do we guarantee the students in the campus and come back home can really enjoy the care from the family and from the education mechanisms? And from the education perspectives, there is a transfer from the offline education to online education. We have enhanced the design of the online courses. We provided very enriching selections for the online courses. At the same time, we should talk to the teachers and students about the newest requirement of the prevention and control, especially those when we need to monitor the cases. We are not going to give all the informations, and we should guarantee a really prompt supplying mechanisms, making sure that all the teachers and the students understand the situations and accept and deal with the situation calmly and peacefully. And finally, we should work on the monitoring mechanism. For these times of the COVID-19 prevention and control, affected by the newest strain of Omicron, the affecting period and also the confirmed times is also very key, and we are seeing that the relaxing mood is affecting the prevention and control mechanisms. From the perspectives of the Ministry of Education, we should implement the responsibilities. And once the cases occurred, we should focusing on the prevention and control. And this should be a systematic self-screening and self-saving measures to figure out the loopholes in the education systems and deal with it. This is what the education system can do facing this unprecedented occurrence of the COVID-19. While we are trying to summarize the experiences during the battle against COVID-19, for example, last year, the Fujian province has timely conducted the PCR testing and figured out all of these PCR testing results, winning a lot of time for these areas. For these 23 provinces and regions, we have conducted this timely PCR testing, and we are requiring that all the regions and the governments should implement this mechanism. Secondly, how are the universities and colleges to implement these mechanisms? We recently understand that in the Mongolia Autonomous Region, it requires for each one of the local district government, they are responsible for one school. If there is any emergency occurred on this campus, the region and district government should be responsible for the transporting effort. This is closely related to the inadequate prevention and control resources and providing us a very effective solution, reflecting the greatest advantage of the socialist society. We also want to promote this mechanism to help the college and universities to deal with this situation. Thank you very much. With China News Network, during the previous presses, we have noted that the elderly people is suffered from a higher risk of mortality once they get infected. Can you give us more information about that? Thank you very much. Indeed, for these elderly people, especially elderly people with underlying disease, they are prone to the high-risk group during the COVID-19 infection. According to the latest statistics, among the severely groups of the patients, around 65% of the population is elderly people above 65 years old. For those severe cases, 80% of them is still suffered from the underlying disease. 65% of them are not inoculated. That's the reason why we are calling for an inoculation for those elderly people. They should be inoculated in time. It is the statistic that we have observed so far. The enhancement of the prevention, control, and treatment of the elderly people is some of the experience that we have summarized since the outbreak of COVID-19 in the city of Wuhan. As noted by General Secretary Xi Jinping, we should be people-centered and people-focused. We should also enhance the medical treatment for the elderly people. Apart from the method that we are adopting, one people, one testing, the combination between the Western medicine and the traditional Chinese medicine for these of the elderly people, especially this effort in China. In the past 2 years' experience, we all have also came up with a very unique experience. That is to say, quite simple. We should move the threshold forward. For those of the highly risk elderly people, although they are not going to be a part of the ICU department, the Chinese experts is going to include them in what we call a sub-ICU. And in that sub-ICU region, the nutrition and monitoring mechanism is stronger than the common wards. But unlike ICU, it is not strictly managed. as the ICU. In what we call the sub-ICU, one of the major feature is about the medics, which is being facilitated in the sub-ICU. One of the key areas is to have a very dynamic controls for these elderly people, especially for the saturations of the blood oxygen. Once there is any trend of the deterrence occurred, we are going to transfer these elderly people into the ICU. The reason we are setting up the sub-ICU apartment is because we are going to block the latest progressions of the sub-ICUs, and we are also going to block these people in the sub-ICU instead of the ICU. For those of the elderly people with multiple comorbidities, we are conducting a multidisciplinary treatment, treating the COVID-19 as well as the cardiovascular disease, hypertension, and diabetes. We also understand the facilities of the blood vessels of these elderly patients means that there is an easily occurrence of the clotting. We are also going to adopt some of the anticoagulation methods. Through this accumulated medical experience, our national treatment method to the elderly people is very satisfying. Thank you very much. With coverage news, are there any selling channels for the public to buy the antigen testing? So how can they conduct the antigen testing? Thank you very much for your question. Once we have printed the antigen testing, it has caught the eyesight across the society, especially the general public want to understand what is going to be the targeted people for the antigen testing. And there are some of the residents who are willing to buy the antigen testing. If you really want to buy some of the antigen testing, if you have such a demand, you can come to the grassroots medical clinics, because after so many years of the reforms of our medical system, within 15 minutes you can go to any grassroots clinics. If you want to conduct the antigen testing, you can use the internet and online shop to buy these antigen testing agencies. Recently, there are 5 different types of the antigen testing agencies granted by the Chinese Bureau of Pharmacy and Food. And through the online selling channels, there is going to be more and more antigen testing agents. Just before I have entered into this presser, I have landed and I have actually logged in one of the 2 famous e-commerce platforms, and I find that I can buy the antigen testing. And if you figure out that you have been tested positive in the antigen testing, we have came up with a principal requirement. If the residents have been tested positive for the antigen testing, they should be reporting to the local community. And the local community is going to refer to the emergency center and call 120 to transfer the patient to those of the medical centers who is capable of the PCR testing, and with the confirmations of the PCR testing, the patient is going to enter into the closed-loop system. And they have also conducted some of the nationwide television conference requiring that all the provincial level centers is going to detailize the result for these of the grassroots institutions. We should help the patient with the inoculations. Who are we? And we have a very clear instruction toward the reporting chains. And for each one of the provinces, they are going to come up with a very detailed requirement. And one of the major requirements is that the antigen positive should be closely related to the PCR testing. And one thing we should remind all of you is that for those of the patients who should stay at home, once the antigen testing results turns positive, all the testing agencies and testing tubes and testing cards that you have been used needs to be sealed. And our works, once they have entered into your home, they are going to collect all these materials as a medical trash and deal with it. We only have time for the last 2 questions. Thank you very much, 21st Century Economics Daily. Across the country, we are promoting the inoculation work for the COVID-19. So for those of the elderly people who have been inoculated, should they receive the enhanced inoculation? Thank you very much for your question. We have noted that the elderly people is a vulnerable group among the COVID-19 pandemic. One thing is that with the rising of their age, their immunity is declining. Another thing is that with the rising of their age, they have a lot of underlying disease. Just as Madam Jiao has mentioned, that the 2 figures, 85 and 65, has once again echoed with this idea. No matter what kind of infectious disease that we are seeing, one of the major key groups of the population it is triggering is about the elderly people and younger people. It just works in COVID-19. So without inoculation, the mortality ratios and the severity ratio is quite high. This idea has been tested once again in the past 2 years' experience. Since the end of last year, the Omicron mutation and Omicron strain is creating a lot of damage for the elderly people because we are seeing that there is a high risk of occurrence. Under these systems, for those of the elderly people who are inoculated or who are not fully inoculated, if they are, we have seen some of the mortality occurred in other countries, or the ratio for the severity has been surpassing the historic record. Under the current situation, we are not going to take the COVID-19 or the Omicron strain of COVID-19 just as a big code. Since the elderly people is a vulnerable group and easy to be attacked, we should inoculate them. And we have emphasized once again that it is very important for the enhanced inoculation for the elderly people, and we should remind them of the prevention and control and do not cluster up. The personal PPE and also the management is going to be very important. Avoid any cluster up for the elderly people. Definitely, inoculation is one of the major works. Thank you. Thank you very much. Time only for the last question. Thank you very much. With Oriental TV, can you introduce us that what the specialities and the sensitivities of the antigen testing? Are they going to be any false positive result or false negative result? Thank you very much for your question. The sensitivity of the antigen testing agent is between 85% to 95%, while the speciality is between 95% to 99%. Because we have done a very good job of the prevention and control of COVID-19. The sensitivity is below 1 in 1 million. If we have grabbed a testing case and test in a city where 10 million people is dwelling in, we are going to get 30 positive results. Among the 30 positive results, there's only 9 is the true one. The other 21 is the false positive result. There is a very low ratio for the false negative result. If we are conducting this testing in the region, there is 85% of the testing. With the 98.5% of the positive and 95% of the negative, I believe the majority of them is going to be positive, and so the loophole is going to be less than 1%. The antigen testing is going to be used for these high-risk, high-clustered-up groups. For the regular groups, do not go to the antigen testing regularly. Thank you very much. That concludes today's press conference of the Joint Prevention and Control Mechanism in the State Council. We have given you a detailed introduction toward the antigen testing, the latest occurrence ratios, and the education systems, and the prevention and control in the elderly groups. We understand there are some of the journalists who keep asking questions. We are going to continue the press conference. Please stay tuned. We officially conclude